Obstructive sleep apnea. Introduction. As soon as a person falls asleep, he or she goes into deep sleep.
Select true or false.
Correct. A person has to go through drowsiness and light sleep before reaching the deep sleep stages. All people with obstructive sleep apnea are aware when their breathing is interrupted and they are awakened to resume breathing.
Select true or false.
Correct. Most people with obstructive sleep apnea may not be aware that their sleep was interrupted. It is usually another person sleeping in the same room that notices the sudden snort and complains about it. All people with sleep apnea experience a complete stop of airflow to the lungs.
Select true or false.
Correct. Many people with sleep apnea have a partial block of the airflow to the lungs. This may still cause a brief sudden awakening as the brain senses a low oxygen level. It also causes the heart to work harder to pump more blood so the body can get the oxygen it needs. Which of the following medical conditions could be caused by sleep apnea?
Choose one of the following options.
1. High blood pressure. 2. Heart attack. 3. Stroke. 4. All of the above. Correct. Sleep apnea is a serious medical condition that could cause death.
Select true or false.
Correct. Sleep apnea is indirectly fatal. In the short term, sleep apnea could cause death as sleepy drivers have car accidents. In the long run, sleep apnea could weaken the heart, causing heart attacks and stroke. If one of your parents has sleep apnea, you are more likely to have sleep apnea.
Select true or false.
Correct.
Children can get sleep apnea.
Select true or false.
Correct. Obstructive sleep apnea can occur in children. If your child snores, you should discuss it with your child's doctor or healthcare provider. Which of the following signs of sleep apnea is the best indication of the disease?
Choose one of the following options.
1. Stopping breathing during sleep. 2. Feeling tired. 3. High blood pressure. 4. Snoring. Correct. Stopping breathing during sleep is the best indication of sleep apnea. This is usually followed by a loud snort as if gasping for air. If your bed partner does this, advise him or her to see a doctor. Which of the following is the most common treatment for moderate sleep apnea?
Choose one of the following options.
1. CPAP. 2. Mouthpiece. 3. Surgery.
Correct. CPAP is the preferred method of treating sleep apnea.
Thank you for using Explain.